We have one last speaker this morning, and why don't we turn to you, Naomi. Naomi Goldstein from the Administration for Children and Families.
Thank you. So I oversee research and evaluation at the HHS Administration for Children and Families, and I'd like to tell you a bit about how we do our work, highlighting implications for your deliberations and drawing on ACF's evaluation policy, which establishes 5 principles: rigor, relevance, transparency, independence, and ethics as listed on the slide. I'd like to make 7 main points listed on the next and final slide. My comments...
It's too bad that Ron had to leave to go do his presidential duties at APAM, because he would have loved that.
My comments echo many already made, but I won't let that stop me. So, 1, data are necessary but not sufficient for evidence that can inform policy and practice. It is no small thing to collect data that are valid, reliable, relevant, and representative, but data alone are not evidence. To turn data into evidence, we must examine them using a sound analysis plan. In addition, for many questions, especially questions about the impacts of policies or programs, an evaluation must be designed and put into place before the data are collected. A randomized control trial is an obvious example where the study must assign participants to treatment or control groups before providing services and collecting outcome data. This point is related to the principle of rigor in ACF's evaluation policy. Rigor means getting as close as we can to the truth. It is not an optional gold seal. Rather, without rigor, we may be generating answers that are just plain wrong. Rigor is not code for randomized controlled trials, and it is not restricted to impact evaluations. It is necessary in all types of evaluations. 2, specialized data collected for the purposes of specific evaluations are often necessary for learning about and improving program effectiveness. This will continue to be true even as administrative data and ongoing surveys become higher quality and more accessible. There are several reasons for this. For example, some types of information may not be included in ongoing surveys or administrative data. In addition, critical data, administrative data, may not be available for comparison groups that don't participate in programs under study. 3, notwithstanding my previous comments, easier accessibility and improvements in administrative data would greatly streamline many evaluation activities. We don't typically use the availability of data as a starting point for deciding which questions to pursue, but we do use existing data when we can. For example, using the National Directory of New Hires or state unemployment insurance records to measure the employment impacts of an intervention. However, when we need to gather data from multiple jurisdictions, the cost, time, and effort of developing agreements and carrying out data exchanges can be comparable to the costs of collecting individual survey data. I'm confident that your recommendations will help. 4, relevance is just as important as rigor, and implementation and descriptive studies are just as important as impact evaluations. Pursuing rigor without attending to relevance can mean producing work that is elegant but useless. Integrating implementation and impact studies is an especially powerful way to generate useful evidence, helping us not only learn about a program's impacts, but also what aspects of design or implementation may enhance or inhibit those impacts. It's also important, as others have said, to study the characteristics of populations and the context so we can learn which approaches work best for different populations or in different settings. This information is essential for scaling up or replicating evidence-based practices and for improving effectiveness. 5, in order to conduct evaluation, we must have, at a minimum, both statutory authority and funding. This is an obvious but important point that's already been made. Several large human services programs at ACF lack authority or resources for evaluation, including refugee resettlement programs that Jim Sullivan mentioned earlier. Further, most of our evaluation funding is linked to specific programs with little available for cross-cutting studies, although the people we serve have complex needs that do not map neatly onto our programmatic structure. While some agencies, such as the Department of Labor, have broad authority to set aside program funds for evaluation, many agencies, including my own, do not. In addition, we need a skilled federal workforce and a robust private sector to compete for contracts and grants to carry out the work. Our evaluation policy states that we will recruit and maintain a workforce with training and experience appropriate for planning and overseeing a rigorous evaluation portfolio. The federal evaluation and statistical workforce is populated by experts whose skills, commitment, and integrity knock my socks off daily. They are worthy of respect and support. ACF's evaluation staff, whom I know the best, are a national treasure. Private organizations, typically research firms and universities, also play an essential role in carrying out federal research and evaluation. We rely on them in part for practical reasons. For one thing, Congress often provides funds that can be used for grants and contracts, but not for federal staff. In addition, evaluations require specialized staff of different types at different times. A study may need a large staff of survey interviewers one year and a small staff of data analysts the next. It's more practical for us to contract for these tasks than to carry them out internally. In addition to these practical reasons for conducting work externally, this practice adds an important element of independence, another principle that I'll discuss in a moment. 6, several bureaucratic challenges pose substantial barriers to federal evaluation in areas including procurement, information technology and security, and collection of information. In the area of contracting, some federal rules are severely constricting. For example, it's difficult to gain approval for a contract longer than 5 years, but many evaluation questions require more than 5 years to answer. Even more problematic are prohibitions on incremental funding of non-severable contracts, and I'm sorry that I don't have enough time to translate that sentence into English.
Wait, actually, seriously, would you mind saying just a few words more about that?
Does that count against my time? Okay, appropriations law requires that funds appropriated annually must be spent on bona fide needs of the current year. That means that we can fully fund a 5-year contract with one award. However, we rarely have enough money to fully fund a contract in the year of award, or we would be able to start very few things at any given time. We are allowed to kind of string together service components of a contract and fund them at different times over the life of a contract, but that means we have to divide a contract up into different pieces, and it multiplies the complexity, so that a great deal of time and effort by my staff, who are the technical contract overseers, by the contracts staff in the federal government, and by the staff employed by the contractors, goes to managing those complexities, which are not necessary in some limited circumstances, such as when no year funding is provided. I would be happy to provide. Pardon? Yes. Okay. Second area of bureaucratic challenges. In the area of IT and information security, there is ambiguity about the application of several laws to the evaluation context. Whether or not there is clarity in concept, in practice, there is often confusion about how to apply the Privacy Act, the Federal IT Acquisition Reform Act, and the Federal Information Security Management Act to evaluation projects. This confusion leads to delays and expense. In the area of information collection, the same Paperwork Reduction Act rules apply to evaluation as to any other federal information collection. Required public notice periods and review by the OMB Office of Information and Regulatory Affairs take a minimum of 4 months and often 8 months or even more. This timeline can make it impossible to evaluate grants that are funded for only a few years, may prohibit gathering any baseline information on program participants or program implementation, and may prevent the timely provision of evidence to inform decision-making. OMB has developed streamlined mechanisms for some limited situations, but for the most part, the requirements do not differ depending on the scope of the information collection. They are the same for a set of interviews with state officials imposing a total burden of 50 hours, and for a major survey of thousands of people. My seventh and last point is that the federal evaluation enterprise lacks many elements of the government-wide infrastructure that supports and protects the strength and integrity of the federal statistical system. As one example, data collected by federal statistical agencies are covered by the Confidential Information Protection and Statistical Efficiency Act, whereas data collected by evaluation offices are not. Second, the federal statistical system benefits from a formal structure for exchange of information and ideas across agencies, as well as from a statutorily mandated leadership function at OMB. To support evaluation and the use of evidence, OMB has created an evidence team and an interagency council on evaluation policy, which I co-chair. However, these activities remain limited and largely informal. Third, while some agencies have established evaluation policies, there's no government-wide statement of principles for federal evaluation as there is for statistical activity. ACF's evaluation policy aims to protect the transparency and independence of evaluation, insulating evaluation functions from undue influence and from both the appearance and the reality of bias. However, without a national infrastructure, these protections are somewhat fragile. While some agencies, notably the Institute for Education Sciences, have statutory protections for independence, this is not typical. ACF leadership established our evaluation policy, and future leadership could choose to eliminate it. It would be a shame to lose safeguards, such as requirements in our policy to publish study plans in advance and to release comprehensive results, regardless of what they show. The policy also gives authority to the person in my position, which is a career position, to approve the design of evaluation projects and analysis plans, and to approve, release, and disseminate evaluation reports. In closing, I note that the mission of my agency is to foster health and well-being through the compassionate and effective delivery of human services. The importance of these goals demands that we evaluate our activities in order to continually improve. I know that this is true for other agencies as well. You have the opportunity to enhance this work. I especially hope that you'll aim your recommendations at furthering the use of data, evidence, and evaluation for learning and improvement, rather than primarily for answering yes or no questions that are often of surprisingly little use for these purposes. I look forward to your report. Thank you.
Thank you very much. Questions, comments? Allison?
Thank you, Naomi. That was really helpful and a quick overview. I wanted to just focus on your 7th point a little bit. And as the Commission thinks about how we can institutionalize the capacity for evidence building and the evaluation work that you and some of your colleagues we heard from earlier, can you talk a little bit more about whether you think statutory changes are where the Commission should look at? Is it more guidance from OMB, more support from OMB? What other tools and strategies, money? Just kind of wanted to give you a chance to develop on number 7.
Sure. I don't know that I have a fixed opinion on which approaches are the best. Every approach that you mentioned, well, except the money, has pros and cons. I don't think that it is generally helpful for statutes to include a lot of detail on evaluation activities. On the other hand, broad statements in statute about using rigorous or state-of-the-art approaches, broad statements about learning, about authority for using resources for learning and evaluation are extremely helpful. I think that OMB's role with respect to the statistical system and OMB's emerging role with respect to evidence and evaluation have been very constructive. Obviously, my comments about the Paperwork Reduction Act show that I'm somewhat skeptical of centralization and central oversight. So I hope that I don't regret 5 or 10 years down the line advocating for, and I do advocate for, a greater role for OMB or some other entity, although I don't know what it would be, in providing leadership for federal evaluation. I do think that statements of principle are very important. I've been surprised at how much traction ACF's evaluation policy has gotten. It's not something that I set out to do. Our agency leadership pushed me to do it. But having done it, I find that I am asked to speak about it frequently. Other federal agencies have adopted it. your commission has a big megaphone that you can use to make statements of principle, and I think that goes a long way too. So I had some thoughts about some of the questions that were asked earlier, if people don't have other questions.
Sure.
Okay, so one of the commissioners made a point about randomized controlled trials being expensive, hard to implement, and slow, and also tending to focus on the impact on the average person treated. And I just would like to say that I don't think any of those are inherent features of randomization. Other types of studies can also be expensive, hard to implement, and slow, and can focus on the average person. And RCTs can be implemented quickly, cheaply, and relatively easily, and also can look at variations. So I think sometimes RCTs are a kind of a lightning rod for broader challenges in evaluation.
I should have said typical. Because you are 100% correct.
And then Ron Haskins asked how we can not constantly find that programs don't work. So I have three answers for that. One is to design better programs, and I don't mean that facetiously. I think that is the point of this entire enterprise. So, learning what doesn't work is a way to get better at designing things better. I also think rapid cycle improvement studies are promising and emerging strategy that are not focused on big yes or no questions, but smaller, quicker questions about how we can improve practice. I think there are a lot of benefits there. I think the big picture questions and the longer term questions are still important, but some of those smaller questions are also really important to answer and maybe a little bit easier for local programs to swallow. So I wanted to offer that.
Thank you, Naomi. Can you talk about a little bit more about your human capital challenges?
Sure.
What's the availability of talent that for you? How is the system enabling you to get it? And then the third question, I guess, is on the technology question. Is your technology challenge exclusively related to privacy and security, or are there availability of technology procurement challenges in that area as well?
So starting with human capital, I think there is a deep pool of talent out there. I think that graduate education in related disciplines has advanced enormously since my own time. I learned very little about evaluation in graduate school. I've learned a great deal since then, and I am constantly impressed at the quality of the candidates that we are able to attract. Actually hiring them is extremely challenging in the federal context, and I imagine this commission doesn't want to weigh in on the challenges of the federal HR system. I can only tell you that they eclipse the contracting challenges, and that's saying something. So next question, I'm not sure I quite understood it.
On the IT question, number 6 suggests bureaucratic challenges related to information technology and security, and in your narrative you suggested privacy and security challenges. Are there other technology challenges to getting your work done? Do you have the tools to get your work done, or could they improve?
I am not sure of the answer to that question, so let me pivot a little bit. Something that I didn't emphasize was increasing capacity and focus on designing information systems so that they can talk to each other. So there certainly are privacy issues and bureaucratic issues, but there are also technological issues, and I think that's an area with tremendous potential that is increasingly coming to the forefront.
I had a comment and a question. The comment is I was very struck, having spent a lot of time in the federal statistical system, by the parallels you were drawing between the way that the infrastructure that's set up to protect the independence of the federal statistical system doesn't exist with respect to the evaluation function within government. And just speaking for myself, I think that that's something that we'll want to think more about for sure. My question relates to sort of models for building the evaluation capacity within the federal government. Our first speaker this morning was Demetra Nightingale, who you obviously know, and my co-chair Ron was effusive in his comments about the chief evaluation officer model that's been established at the Department of Labor. Do you have a thought or a view about what the right way to structure the evaluation function within federal agencies is?
Kind of. I have to acknowledge that federal agencies differ quite a lot. So how to structure the evaluation function may differ in some degree depending on the context. Just to go back a little bit in history, and I don't know how much Demeter may have addressed this, the current robust evaluation function at the Department of Labor did not always exist and did not come about by accident. There were some unfortunate incidents in the past where the function and was weakened and reports were suppressed. There was a series of GAO reports about that, which I referred to extensively in putting together ACF's evaluation policy. And as I understand it, there's both law and strong encouragement from OMB to develop the current structure that exists. I do think some degree of centralization at some level is important. So at the Administration for Children and Families, we are the primary but not the only place where evaluation is housed. And over the last 10 or 15 years, there's been an increasing move toward centralization within ACF. So there was a separate office for early childhood evaluation. There was sorry, I'm losing track of how my empire has grown. So some of that has been centralized.
You left your tiara at home.
I did. There definitely are benefits. That we have kind of a critical mass of really talented people who can bounce ideas off each other. But people who have been in evaluation offices that are located within programs will tell you that there are benefits to that as well. So, independence and rigor perhaps are better supported by some degree of centralization. Relevance may be better supported by some degree of decentralization. So I think these structural questions are interesting and important. I also know that our Interagency Council on Evaluation Policy is working to kind of gather information on different models and sort of put it out there so people will have something to refer to when working through those questions.
I have a little bit of a follow-up to that, and that is your thoughts about one of the things that we've heard throughout today and in other times is that the lack of resources, not just for the evaluation, but for sort of assembling, cleaning, and documenting the administrative data that agencies are creating as part of their business as usual model. And so my question is, do you think that that capacity would naturally be built into an evaluation structure that you were just having a conversation with Catherine about, or would that better belong in the statistical framework or somewhere else?
Well, I don't know the answer. I will say that my agency, the Administration for Children and Families, does not have a statistical structure. So administrative data are collected within specific programs. We don't have a statistical office. We have recently established a new division, the Division of Data and Improvement, that we intend to work with programs to help improve the quality, usefulness, availability, and analysis of administrative data. So I think we'll be learning a lot about the kind of question that you're asking. There are a lot of related activities. There are statistical activities, there's performance measurement, there's strategic planning, there's evaluation. I think they can be configured in a lot of different ways. I think that it's difficult to integrate them, and I don't think that there's one right way to structure it.
So thank you for coming. Your comments have been quite helpful and thought-provoking. So I'm going to put you on the spot since you've been so helpful.
Thanks.
So, yeah, no problem. So if you were tasked with designing a structure that overcame, I mean, your points 5, 6, and 7 are just, here are all the limitations we have. Lack of a skilled federal workforce and robust bureaucratic challenges, and the evaluation enterprise that lacks many elements of the infrastructure that supports and protects the federal statistical system. What would you do?
I mean, if I were you or if I were czar?
If you were czar? Because I think we get to be czar. I mean, you know, in some sense, at some point we get to be czar, and then maybe we have to be realistic.
Yeah, that's fine. Okay. Well, I would streamline Paperwork Reduction Act requirements for evaluation. I would establish and this may be actually inconsistent, but I would establish an entity that was a central government entity for providing coordination and leadership for federal evaluation activities. To what degree that entity would have authority and oversight, I am not sure, but certainly the coordination and leadership are important. I'd like to reform the entire federal HR system, but I
You already indicated that we weren't allowed to do that, and I think I'm going to agree with you there.
but I might try to create some specialized pathways programs for evaluation. And I would allow incremental funding of non-severable contracts.
Thank you.
Thank you. I guess one additional question, and I don't know if it would go on your wish list, but we've heard a little bit this morning about the challenges that states have in sharing their data, accessing data, and I imagine that especially at ACF and HHS, where so much of the work happens at the state level, that's a challenge. So just wanted to give you a chance to elaborate on anything you would urge us to think about with from the state perspective.
Sure. So I did once work in a state, but it was a long time ago, so I'm probably not the best person to answer this question. You know, I think, as I'm sure has been said at this meeting and other meetings of the commission, there's a complex web of laws and rules at the state, local, and federal levels. It's very difficult to navigate through. I think and hope that there will be efforts to develop, standard procedures for memoranda of understanding, data exchange. I think it will likely have to be an incremental and difficult process, but that's what I see as the way to try to move forward.
Great. I'd like to thank everyone who came to speak with us this morning. We've certainly heard a lot to think about, and we may be wanting to follow up with many of you with further questions. So thank you so much for taking time to come and talk with us. We will adjourn the meeting at this point. This will not be our last occasion to talk about evaluation. We look forward to future exchanges.